Hello guys, my name is Harsha bhosale. You're watching my channel Branch of Science, Education and Knowledge. In today's topic, we will discuss about CBC or complete blood count test. People usually think that whenever I have health issues, doctors suggest me to do CBC test. What is CBC? Why should I do this test? Okay, so here I will explain you basic information, normal ranges and test procedure of the CBC test. In the procedure of this test, technician will collect your blood in EDTA tube which is purple in color, about 2 to 5 ml blood. You can perform this test at any time. There is no need of fasting. This is most common test prescribed by the doctors. A complete blood count test measures several components. CBC is a blood test used to evaluate your overall health and detect a wide range of disorders, including anemia, infection, and cancer. There are 24 parameters in CBC test with normal value and your test result value. But there are few components are more important than others. RBC or red blood cells count. RBC count in men 4 to 5.9 per microliter and in women it is 3.8 to 5.2 per microliter. RBC carry oxygen, the amount of oxygen that's delivered to your body's tissues. The result of RBC count can be used to help diagnose blood related conditions such as iron deficiency, anemia in the case of low count. A low RBC count could also indicate a vitamin B6, B12 or folate deficiency. High RBC count cause may be smoking, congenital heart disease, lung disease, low blood oxygen level, that is hypoxia. WBC or white blood cells. Normal range of WBCs is 4,500 to 11,000 per microliter. White blood cells are part of the immune system. They help your body fight off infections and other diseases. When you get sick, your body makes more white blood cells to fight the bacteria, viruses, or other foreign substances causing your illness. There are 5 major types of white blood cells: neutrophil, lymphocytes, monocytes, eosinophils, and basophils. High WBC count indicate bacterial or viral infections, cancerous such as leukemia, allergic reaction, autoimmune and inflammatory diseases. In the case of low count, disease of the immune system such as HIV and AIDS, lymphoma or leukemia, a cancer of the bone marrow, disease of the liver or spleen. Hemoglobin. Hemoglobin is an iron-rich protein. Hemoglobin in blood carries oxygen from lungs to the rest of the body tissues. Normal range of hemoglobin in male 13.8 to 17.2 grams per deciliter. In females 12.1 to 15.1 gram per deciliter. Low hemoglobin level may be due to anemia, bleeding, bone marrow being unable to produce new red blood cells. This may be due to leukemia, other cancers, radiation therapy, chronic kidney disease, and malnutrition. High hemoglobin level may be due to bone marrow disease that causes abnormal increase in red blood cells, kidney cancer, heart failure, low level of oxygen in the blood. Platelets. Platelets are tiny blood cells that help your body forms clots to stop bleeding. If one of your blood vessel gets damaged or you got some injury, it sends out signal to the platelets. The platelets then rush to the site of damage and form a plug to fix the damage. A normal range of platelet count from 1,50,000 to 4,50,000 platelets per microliter of blood. High platelet count may due to infections like tuberculosis, inflammatory disorders like rheumatoid arthritis, and inflammatory bowel disease, cancer like lungs, breast, and ovarian cancer. Low platelets count may due to viruses such as HIV and hepatitis, autoimmune disease like lupus, chronic bleeding, and liver cirrhosis. So guys, these all parameters include in CBC, and with the help of these reports, doctor give us medications. You can do CBC test in every 3 months to track your health. If found any abnormality, you can take action in time with the reference of doctor. We will discuss LFT, liver function test, in my next video. If you are new, please subscribe to my channel. Thank you for watching.